I had an interesting thing happen. I had a collie that always, every time I had blood work done, they would say the numbers were high, and I didn't have him from a puppy, and I always said, you know what, I think he just runs high numbers. It was his whole life. So when I got my puppy, my Shih Tzu, I decided that I would do a baseline blood test as soon as I got him neutered. That was my plan, get him neutered, do the baseline blood test, and see what's wrong. Well, good thing I did, because it turned out he had some liver issues, which I never would have found had I not done that.
I'll tell you what.
So it turned out to be a good idea for me, because then I had something always to compare it to.
Exactly.
And although it was a little pricey, you know, I said in the long run it was a better deal, because first of all I was able to catch something, and second of all, I've done it with all my dogs now, that later on we can always go back and compare and say what, you know, compare and see what it is.
If Bo is, let's say, coming in to get neutered, he would get pre-surgical blood work, which would include a few of our blood tests.
Right.
And maybe you can print off a CBC and a chemistry off of a puppy dog, and we'll just go through it real quick, what's involved, and print off a, just maybe some pre-surgical blood work. But so if Bo was here for just his wellness and we didn't find anything wrong, we would still want to make sure we did a fecal exam, and we want to do that every year because nobody wants parasites in their dogs. We would do the blood parasite screen, which is a heartworm test, but it's called an IDEX 4DX. Basically now it tests for anaplasmosis, ehrlichiosis, Lyme disease, and heartworm. So those other three are tick-borne diseases, okay? So the anaplas, the Lymes, and the Ehrlichia, those are diseases that are spread by ticks, and so what it tests for is, has a dog been exposed? Has he been bitten by a tick that carried, let's say, the Lyme's bacteria? Doesn't say that he's sick or that he's got Lyme disease, but it will tell us whether he's been exposed or not. So that would be a diagnostic test that we would run generally every other year on a healthy dog, and the fecal exam would be every year on a healthy dog.
Good.
Okay. Other than that, on a young puppy like this, or a young dog that's in the prime of his life, we really aren't going to do a whole lot of other diagnostic tests unless he presented for lameness or he presented for, you know, diarrhea or something like that. But we'll go through kind of some blood tests if he was presented for maybe, let's say he was presented for vomiting and diarrhea. Okay. So along with the physical exam that we already did, we would probably also want to run a blood chemistry and a complete blood count. And in that chemistry, we may want to check for one extra thing called the canine-specific lipase enzyme, which is all done in-house here, thinking, hey, maybe we got a pancreatitis. If the history indicated, you know, if, let's say, Bo was 10 pounds heavier, had a little extra condition on him, and he came in, let's say, the owner said, well, 3 days ago, we had some leftovers, and there was a lot of gravy and some pork chops, and Bo found it in the garbage when we threw it out.
The old Christmas and Thanksgiving
exactly. Deal. So, and he presented with vomiting and diarrhea. We would probably say, wow, it sure sounds like pancreatitis. So let's say we did our physical exam and he had a fever. It was really tender in the abdomen. I would kind of want to know how severe this pancreatitis is. And so this blood work that we're going to go through would give us a pretty good idea, such as a white cell count. That'll give us a pretty good idea what how serious a condition it is. Say pancreatitis can be anything from just a little day or two of vomiting and a little diarrhea to death. I mean, they can actually go into shock. Not that it happens very often, but it would be something that we would want to be aware of. So I'll give you kind of an example. This is basically a complete blood count.
Can you see that, Kevin? Okay.
So in a complete blood count, you will have the number of red blood cells. Red blood cells carry oxygen. They will be represented as a number per microliter. So that's, this puppy dog had 6,000 red blood cells per microliter of blood. And then also in that, it's also represented as a percentage, which is 41.8%. So what that means is if I take any unit of blood, spin it down so I get just the cells, just the red blood cells, 48% of that unit of blood is red blood cells.
What's that called that spins them?
A centrifuge, or a microhematocrit centrifuge. This is actually done, we can do it both ways. The way this test here was done is with, it's called a CBC machine, and it's really neat. What it does is the cells are dropped one at a time through a light beam. And the size of the cell is pre-programmed into this computer on this machine. So as it the cells drop through and they break that light beam, they count them. So that's how they're counted. So it's a very precise machine. It counts
all
cells.
Computerized.
All computerized.
Wow.
So the neat thing here is we get information on, hey, is the dog anemic? Does he have the proper amount of red blood cells? And you can see in this dog, everything in this normal range. Normal range. So this is telling us, hey, we got the proper amount of red blood cells. It also tells us how much hemoglobin is in those red blood cells. It also tells us, are those red cells the normal size? Are they bigger, smaller, or are they the normal size? If they're bigger, that usually means they're younger red blood cells, meaning the dog's responding to an anemia.
What portion of this test is done just as a preliminary for, if I'm bringing my dog in to be spayed or neutered?
This is
the test
This is done. This is called a complete blood count. It also measures the number of white blood cells. And the number of white blood cells will indicate whether is the dog got an infection. If it's got an acute, overwhelming infection, the white blood cells are going to go down in the blood. So the white blood cells are basically like soldiers in the bloodstream.
Okay, and this is the CBC.
This is called a complete blood count, or CBC.
All right, now.
So this would be done on any patient here that is getting surgery. And the third thing it measures is platelets, the blood clotting cells. Are they high or low, or where they want to be? Sometimes we'll get results that show the platelets count is very low, and we'll do something else to make sure we got an accurate count.
Okay, abnormality here. Now what do we do next? What's our next
Okay,
choice?
so let's say it does come back with the platelet count is low, meaning, okay, first thing we do is make a slide, and we look at the slide. We should see these platelets on our smear. If we don't see them, then we're going to say, ooh, it does have a low platelet count. Now we got to figure out why. Okay, are the platelets getting consumed somewhere? Let's say the red cell count is low. You're anemic. All right, what's the next step? Well, we got to determine, are we losing red blood cells, or are we not making red blood cells?
Is this another draw of blood, or we can do it from the original?
We can do it from the original. Okay. So let's say the puppy dog comes back, it's anemic, and we're thinking, you know what? We're losing blood somewhere. All right, we're making it, but we're losing it. So then first thing we probably do is take an X-ray, okay, to see if there's a body cavity that's filling up with blood, chest. Let's say a puppy dog.
Couldn't do that with a sonogram?
No, let's say if it's a chest.
Okay.
The problem with the chest, you could put your probe on there and you could see that layer of blood between, but lungs won't show up on a sonogram. They're air filled, and you'll just get a kind of a white screen there. But you could. The easiest way is take an X-ray. So we get dogs in here that maybe we don't know have ate rat poisoning 4 or 5 days ago. They'll come in. You lift their lip up like we did on Bo, and boy, he's pale. Let's run a CBC. We run a CBC. His red cell count is way low, so he's anemic. And he's breathing hard, So we're going to take an X-ray, all right? Because that's where the blood's going.